This time each May, we are invited to celebrate the amazing nurses who serve us tirelessly all year long. It's National Nurses Week, and Dr. April Kapu is the president of the American Association of Nurse Practitioners. Good morning.
Good morning and happy Nurses Week to all nurses out there.
And we have many here in the Tri-State who serve so faithfully and so well. So, Dr. Kapu, I want to ask you, what has the pandemic, what impact has the pandemic done in the public perception of nurses?
Well, as we know, nurses work they're foundational to healthcare. They work in all settings. They're in the hospital, in clinics, in community centers. They're just everywhere you're going to access healthcare, you're going to come in contact with a nurse. Nurses are innovators and they're leaders, and they have stepped up over and over again throughout the pandemic. Nurse practitioners have been setting up community tents, drive-throughs, testing sites early on in the pandemic. They were putting together makeshift emergency departments. They were expanding ICUs as patients were coming into the hospital. They were seeing patients in the home. They were expanding telehealth. They were setting up mass vaccination clinics, even going door to door to talk to people about getting vaccinated and how important it is. So we have seen more than ever before nurses stepping up and really meeting the challenges that have come with a sustained pandemic over the last 2 years.
It's just been so powerful, I think, for all of us to witness and certainly for the nurses to experience. So listening to that impressive list you just made, how do we guard against nurses burning out?
And that's something that we have really seen throughout the pandemic. Interestingly, according to the National Academy of Medicine, healthcare workers were showing signs and symptoms of burnout prior to the pandemic. Now we see the physical exhaustion of working day after day, night after night, filling in for your coworkers, coming in when you aren't going to work because of the workforce shortage, because people are out due to COVID or their family members are out. And then the mental and the emotional toll of the pandemic has been significant. Patients are very sick with COVID-19, and we were learning, and the science was evolving throughout the pandemic. So the mental and emotional exhaustion has been significant. So what are we doing to really surround our nurses, our nurse practitioners, make sure that they have ready access to mental health services, that they're working in an environment that is a healthy working environment, that prioritizes their self-care, that has policies in place to protect them from overworking, that they have readily accessible mental health services right then and there, such as grief debriefing from when their patient passes away. These are the types of things that we really need to pay close attention to so that our nurses will continue to care for themselves. We care for them so that they can bring their very best self to their patients and do what they enjoy doing, and that is caring for patients.
Well, I can see you're such a passionate spokesperson for your colleagues, and that it really shines through. Can you send our viewers to a website where they can learn more about your work?
Yes, we have a website. It's WeChooseNPs.org. It's WeChooseNPs.org.
Thank you so much, Dr. Kapu, for being with us today.
Thank you, and happy Nurses Week to all the nurses out there.
Thanks.